Oh, another. You ready?
Oh, we're jumping right
Oh yeah,
into
we're
it.
jumping right into it. I ain't even waiting because it's
Okay.
on my tongue. Today we're covering some ABA stuff, and she kind of struck my nerve a little bit in the car with something, and I didn't want to start the conversation until we got here. So here we are. We're going to cover ABA today.
Okay.
So I want to hear your pros because you were definitely aren't ready for my cons.
I already know a good majority of pros and cons with ABA therapy just from our experience ourselves. So, with having friends that are ABA therapists and what we've experienced with the centers as well. The pros of ABA therapy, in my opinion, is it does teach behavioral skills that our children lack. With their lack of being able to communicate wants and needs, they still need to know social appropriateness, and ABA therapy helps them. Examples of this would be like greeting somebody is like shaking a hand and stuff like that, not necessarily going up somebody's shirt or their skirt or,
Pulling a boob out or something.
yeah, which has happened a couple of times. Luckily enough, it was mostly with mom, and that's what happens when you have booby babies and you have autistic booby babies. Is you have to eventually untrain them of certain habits that they become accustomed to. And ABA therapy is also there to help these children um, kind of correct certain behaviors that have been set in place, which
So
were appropriate at an earlier age, but not so much as they age.
here's the one I'm gonna strike you with.
Okay.
If ABA is so helpful and does so much, why does it require no skill to get the job?
It's not necessarily a no skill.
Yes, it is.
Well, yes and no. You have to have certain people skills in order to be an ABA therapist, and you
Anyone
have,
can get hired to be an ABA therapist, whether they have someone with autism in their family, um, or if they don't, or if they know someone, or if they don't, they can still get a job in that field.
as long as they're willing to take the hours of training and learn the
How
material.
many hours of training does it require?
40.
40 hours of training. Do you think in 40 hours of training, you can even touch a tip of what autism is to work and think you're going to guide a child in the right
But
direction?
ABA therapy isn't just for autism.
I This is the majority of
But there's also,
ABA intakes are from autism. The
yes,
majority.
that is the
Okay, so
primary
again,
use of ABA
let
therapy
me
is
ask
for
this
the treatment
question.
of autism.
Do you think someone with 40 hours of training is adequate enough to teach your child the aspects of what they're there for?
Yes and no, it depends on that person.
Yes and no. It doesn't depend on the person.
Yes, it depends on that person's level of
Okay, so let's
caringness.
bring up this right here. Do you think that much money an hour is going to make you be that dependable person?
To some people, that is, but do I think that needs to be a higher amount? Yes, I do agree. So what we have up here is the salary of, say that word for me because I pronounce.
Salary,
Thank you.
not a vegetable. It's not
So the
celery.
average pay of an ABA therapist in Michigan is $15 to $22 an hour. I can say personally for myself, I am currently going through PT certification to do the boys as ABA therapy at home since we are having difficulties with finding a center for them right now, due to the lack of
Which personally I don't agree with, but I'm letting her do her thing.
ABA therapists that are available. And yeah, there's a huge wait list. So I am going through this training myself and doing the ABA therapy at home, and uh, completely lost my train of
Okay,
thought.
so I'm going to help you out with this.
Yeah.
In our business that we own, what is one of our mottos to getting things done? let the experts do the job that they're experts in, correct? Isn't that
Yes.
what we say? Put the best person for the job on that job.
Yes.
That's how you get more efficient work, right?
Hmm.
So we'll just use the horrible ABA center that we had. Horrible, by the way. Um, let's use them as a reference, okay?
Okay.
How many different ABA therapists did Theus have in the 1 year that he was there?
Anywhere between 5 to 7.
5 to 7. So between them, 5 to 7. So 5 to 7, that means every other month he got a new worker. But
Basically, it was
part of the problem
rotation,
was
yeah.
is we noticed that every day he had a different worker. They were rotated. So he's never with the consistent person at the same thing.
Which we
What is the
know.
one thing that we know about ABA centers? Everyone does it different. Regardless of their training, they all do it different, correct?
Correct.
So if your child is going to ABA 5 days a week and has 5 different people, there's now 5 different ways that that is being taught to them or used to them by people that are not experts in their field.
That's correct.
So where is an ABA therapy center good? Because I don't see good in that. It's no different than the school. Why do we leave our kids with someone that doesn't have the experience in doing what they're doing? Why is there not more requirements? If there's so much requirements for our kids to be in that therapy, why is there not just as many requirements, if not more, or restrictions to those who are teaching them or working with them?
Okay, so the only thing that I have to say to this is that there's 3 levels of ABA therapists. There's that of let me bring it up here just so I can recap, because there's BTs, which is the very bottom. These are behavioral therapists. You only need 40 hours in order to get a certification. You have to pass an exam. The next one up from that is a BACBA, which is the supervisor to that of a BT. But above that, there is a BCBA and a BCBAD. The only difference between those top twos, the BCBA and the BCBAD, is that one has a doctorate and the other one has a master's. And the only difference between those two and that of a BACBA is the other two have masters and doctorates.
Okay,
And
so
the second one has a bachelor's degree.
okay, so if if somebody has an MBA, I'm fine with that. Masters, bachelor's, associates, that's what that stands for. And that's acceptable for me. Even if you have an associate's degree, I at least know that you went through 2 years of schooling to show your dedication that this is your craft that you want to work in. These people that do these 40 hours of training, we know how many employees that one center went through in a year. Over 20 employees we watched go in and out of that building.
Yes.
Okay, where is that helpful to any of them kids? Where does that help them with they need consistency? We know how Theus is with certain people.
Mm-hmm.
And when you grab onto something, look how he was with John. He was that way with John.
Oh, yes.
And then when John got took away from him, he had fits.
Yes.
And he had a lot of hard time with it.
Mm-hmm.
So this is my point. How do you find that to be good? Because that's not good.
Because life is inconsistent. And even though for a child with autism,
you make it as consistent as possible because it'll make your life easier.
But at the same time, life can never always be consistent. There's always variables.
That's not the purpose as a parent. That's not my job as a parent at this point. My job as a parent of a child with special needs is to make sure that he has everything and anything that he wants when he needs it, period. That's our job.
Understandably.
So that means what you just said, it's nil, because it's not. You have to give them that. And if you don't, it creates problems, and it creates more problems down the line. And the difference is problems created with a child with special needs is a lot different than teaching a standard child that bad things happen to bad people, or life, this is life, this is how it goes. You can't control all of that. They don't have the ability to understand that. They can't grasp that piece of paper that is out of
Understandably.
so you're intentionally making their life harder by knowing what you're doing is making it harder for them when you could change that.
Well, here's the thing is that all of it's a double-edged sword, no matter what degree of parenting it is that we apply to our children, it's always a double-edged sword. Whether we create the perfect routine and all their needs and wants are being met at a very consistent, timely fashion and stuff like that, at some point in the future, something may go awry. Something may not fit exactly into that time frame where we can keep it consistent. It's better to condition our children now than it is in the future when they get a lot bigger than us,
But
a lot stronger than
this is
us.
the
And
difference though, is conditioning don't work as like normal. You can't, it doesn't. We know this. We watch it every day. Anybody that has a child with special needs know that conditioning is not the same. It's not. It's a total different platform for us.
understandably.
You know what I mean?
Hmm.
You okay?
Yep.
Are you sure?
Yep. Continue.
I love you.
Love you too.
I
Continue doing what you're doing.
wasn't trying to, I'm not trying to hurt your feelings. I'm not trying to piss you off. I'm just trying to,
I'm listening.
I want you to see it from a different aspect. I don't,
Hmm.
now you got me feeling bad because you're crying.
I'm not.
But okay, you're not. So either way, move on. Let's go to the next one. I mean, that I'm just feeling, in my opinion, ABA needs more education. It needs more finances. I don't I at this point where I'm at, I don't agree with ABA therapists. I don't agree with the whole ABA centers and the you gotta wait to get in line to do this. If it's so important, why do I gotta wait in line? Why is there not more buildings or more places dedicate, to this? Why is that not being done? Why is it that the people that are taking care of our kids through these centers require less training than our kids are required therapy in a month? Why do they get paid so little? No one's going to want to go in. That this is the thing.
That's
When
exactly
you
the
when you
problem.
pay little, okay, and this is my biggest problem. How do you feel when you work a job and it's the lowest paid job? You're going to give low paid work.
Yep.
That's how people are. It's human nature. So you pay these people peanuts. They're treating our kids the way that they're getting paid,
Yeah.
which is not good.
Understandably.
It needs things get overlooked. Shoes don't get put on.
Yes.
You know what I'm saying? Backpacks get forgot.
Hmm.
Simple things. Coat don't get put on.
I
Don't
agree.
realize you don't even have the kid with you. Like it's
That one escaped me. Like,
Theus in the car.
okay, let's continue.
No, I was just
I
stating
I I can't catch a reference. I don't
going
recall
in the
you.
house and not realizing that we went in the house and left Theus in the car. Like, oh, wait a minute, Theus still in the car. We had Loki. We didn't have Theus. We both come in. You thought I had Theus. I thought you
Oh,
had
okay. Yep.
Theus.
I remember what you're referring to now.
And it's literally as soon as we come in the back door, 30 seconds later, we're both like, you didn't grab Theus? Oh, he's still sleeping in the back seat of the car.
Right.
I'm just, and we're parents. And
Right.
I'm not here just to call everybody else out. I'll call myself out on the problems that I've done too.
Oh, yeah.
It's no different than the home, the things that we have going on in the home right now. I mean, honestly, our next course of action is armor guards on the window.
Yeah.
That's our only next course of action. And if any of you guys have problems with your kids escaping, please tell me what you do, because like we went and got window sensors. We've got an alarm on the house. We have cameras in the house. I have cameras outside the house. And I
And our
still
kids
can't.
are progressively learning faster than we can put more safety precautions on the house. Granted, our children are safe. They are in the house and they haven't escaped in a while.
This is why
But
I don't
they're
sleep at night.
still,
Like literally, I don't sleep at night. I'm up until 4, in between 4 and 6 in the morning. And normally when I go to bed, I wake MacKenzie up, and MacKenzie will go upstairs, because our kids literally only sleep 3 to 4 hours at a time, and then they get up, and then they'll be up for an hour or two, and then they'll lay back down for 3 to 4 hours. So sleeping in our house is, extremely hard, and the hence with the ABA stuff, that it made it messed with their sleep schedule even more, because they were, and this was going from school of 9 hours, and then half hour in between to the center, and then
it honestly
do
helped
the
us
three
though.
to tire him. Excuse me.
Provide him with that stimulation that he needed in order for his brain to go, shh, it's bedtime at night, and
And
actually
this
sleep
is
all the
part of
way
the
through the
reason why
night.
I brought this up, is because one of our kids does benefit from ABA. As much as I don't care for it or I don't like it, it helps him. So I'm going to go for it. If it works for him, it works for him. It does not work for Loki.
Not center based.
Not
No.
center based, and not just center based. I don't believe Loki was comfortable there. I don't think Loki was. He didn't. He
It's
just
too much
didn't
time
feel
away
the
from
groove.
home. He
And
went from
yeah,
being at home from newborn all the way up until he was 3, almost 4, and then went to pre-K, and we had that separation anxiety with him.
well,
With
we went through
taking
that.
him to
We went
school.
through that at the pre-K. He would, sit there and cry, or when you were leaving, and not wanting you to leave and things like that.
Mm-hmm.
But after a couple of days, he got through that.
But we would always have spells of it as well, when he would come home for a 3-day weekend and then go back Monday and realize
We haven't
we
had
have
that
to do it
happen
again.
once at the new school.
The first week. The first week he was good at his new school. The second week, though, once he realized that he has to come back and do it all over again after taking that summer vacation of 3 to 4 months off, because of the time that pre-K led out to the time that we got his diagnosis over the summer and got his IEP set in place to get him started at ECPS, that's when it happens at his school. You did it last time. I could make a couple
I
mistakes
said a
my own
teacher's
self.
name. You said,
Well, it's a school.
yes.
So, but he did have that transition phase of a week of crying every time we dropped him off at the school. But then once he always still looks back
Not
at
really.
us
He
when we
just
drop
does
him
the
off.
look back thing. Is like his big thing. Well, the new thing this morning, the stop, walk, stop,
Oh, he
walk,
does that to
stop.
me at home too. It's a hesitant thing of, yeah, I'll go. No. Yeah, I'll go. No.
No, we're gonna stop. No, we're gonna go. No,
It's
we're
that
gonna stop.
indecisiveness.
So I
And
just this is why I don't know, the ABA. I think there needs to be a lot of changes in it. The system needs to be fixed. It's definitely a wheel that has a bunch of rocks glued to the bottom of it. So you're going as you're rolling down the hill.
right.
Like it could definitely be a lot smoother.
Mhm.
There's a lot of things that they could change to make things better. And I mean, not trying to knock what you're doing. I'm glad that you're trying to do this and that you're trying to learn to do things better for our kids. I I have a problem with it, because I think it coming from a parent is different than coming from a therapist or someone. Not saying that your training isn't enough of a training. Don't take it the wrong, because I already feel how I can
Um,
feel it all over on
no,
the
no,
side of me
no.
here.
That's not what I was going to say at all. I think I actually kind of insulted the people that I've been doing the training through when we were first talking about it and getting it set up and all that good stuff. Is that pretty much told them ABA therapy is just glorified parenting. Everything that you guys are teaching the kids is the same thing parents are supposed to teach their kids.
Hence why I have
Just-
such a problem
Just
with it.
slowed down and more intensified in certain areas to bring it down to autism speed.
You really
to-
help bring up reiterate my point more. Thank you. But, what
That's
is
for
this?
respite care.
Oh yeah, the respite care. See, and that's the other thing. Okay, I'm glad I've seen that. That's the reason why we were starting to get a little side. So I wanted to. So this is the other, and this leads back to the same thing.
Mm-hmm.
So it is, Catherine's less than 10 hours. Now I don't even think 10 hours of getting qualified for respite care.
Mm-hmm.
Now, I will not say that she's not capable of it, because she is way more than capable of it, and she does a wonderful job.
Mm-hmm.
She's very good with it. But what type of training does she have other than them or her two cousins and Charlie?
Respite care is just glorified babysitting, and me and the case manager have had her around with that as well.
This is my point. And they're low paid.
Yeah,
I'm not going to, I have to
$12 to
use this
$15
word,
an
and
hour.
I'm not saying that this is everyone, but the majority of are unqualified. They really
Well,
are.
there's also a shortage of them as well. That's why they ask you, or they tell you actually, when you apply for respite care services, that if you have a family member, if you have a friend that your kids are comfortable with and you're comfortable with being around your kids, it's probably best to bring your own person, because they are
Okay.
And a lot of them are actually independent respite care workers.
I'm gonna give
agency.
you a little scenario, okay, and just ride with it. Excuse me. Okay, Steve can go and become a respite worker right now. He could go and take the paperwork and do the respite worker.
Yep.
All right. You don't have any kind of autism in your family, or for the most part, nothing known, right? Or anybody that you deal with on a regular basis with autism. So if you were to go and become a respite worker and he were to take the boys, do you think he's going to have any clue how to deal with a biscuit party when it happens, or what the details of telling him what that's going to happen, or even in an emotional breakdown? Do you think he's going to have the knowledge of how to deal with that?
That's when they're
When that
supposed to
happens.
contact us, and
That's not
guide
how
them.
respite works. They're not to call you when they have them. That's the whole point of a respite worker, is for you to have a break, not to be interrupted while they're on respite.
Okay.
So do you think that's fair to the kids that are being watched by someone that has zero qualifications to handle that
It's also
situation?
on the parent too, to make sure that they have somebody.
Okay,
that
so
has
what about
experience
parents that
and-
don't know any better? Or parents that are told, well, you can look from this list of respite workers and pick one out of here. Someone you don't even know.
Then that's somebody else failing to do their job as well.
And then you're gonna let your kids go with them, and you don't have not a zero clue of what's going on. Because there is parents out there that do that because they don't know better, and because they don't have any idea of what's going on, that are brand new, fresh to this, just now getting their diagnosis and things like that, that don't have a clue of what they're getting ready to get into.
But they should still have that parental instinct of, I want to
Do you
make
think
sure.
your other half has that type to know?
I think I know what you're referencing.
Oh, you know exactly what I'm referencing to.
They should, but
They should, but they
can't
don't,
speak.
and you know that.
I can't speak on their behalf.
I'm just stating. I think about it.
That's a matter of opinion. So
It's not everything is an opinion. Then, if you go with that point, this is why I'm trying to get you to look at things on the other edge, and not be frustrated or mad at me because I'm bringing forth the hard questions that you really don't want to hear me say, because you think I'm being an asshole. And I'm really not trying to be an asshole. I'm really trying to get people to understand that I look at things from a different angle.
It's two different perspectives. There's my perspective and your perspective, and everybody has their
There's
own
everybody
perspective.
else's perspectives, and there's the right perspective. I'm a part of the every other part as well. It doesn't matter. But there's always one thing that's always right to do in that situation. And that's what needs to be done. And it doesn't matter if it's how you feel about it, how I feel about it, how they feel about it, how anybody feels about it. You still need to follow that dotted line. And when you don't know how to find it, you need help to get in there. Yeah. How long did it take us to figure it out? With just going through with just this, just figuring out the very basics of autism. How overwhelming was it for you?
Extremely.
I know how overwhelming it was for me.
Extremely.
Extremely.
For the longest time, we had family members that were
Rachel
all like,
was the only person that we could call. It truly was. It was Rachel and Chaz were the only two people that we could call. And still to this day, last week I called Rachel and vented. I still called her and just asked her, like, how and what. And because she's been dealing with it for 2 years longer than we have.
mm-hmm.
So I still look to her for
It's good to have somebody
comfort
that
and to talk to and to ask
help
her
us guide
questions
us.
about what's going on with her kid. And because her kid goes to the school where our kid's getting ready to go to, I really wanted some insight of what's going on there. So I know when that transfer comes, do I need to kick on hillbilly asshole, or do I need to be Mr. Passive and sit back and let them mess up? I don't want to put my kid at that risk, though. It's no different than the food thing. So, what about the nut allergy? What when our kid goes from here to there? What if that kid here goes to there now? Now they got a school that has over
That's gonna be
170
something that's
students.
no matter what.
It's an issue. It's an absolute. It's that broom and dustpan. We're going to take all of these guys and put them all together in one pile and just shove them into the corner and forget about them and tell them they're not. They need to try and normalize. Or how did she word that? The last principal at the school. How did she word that when they were trying to put Theus on the bus for 2.5 hours? Force your kid to be on the bus for 2.5 hours.
Sometimes more,
sometimes longer. Yeah, as if that's a normal thing.
No, it's not.
I mean, it's not like we live way out in the sticks somewhere and it takes 40 minutes to drive to the school one direction while picking up other kids in there. No, this is one bus that comes to your house, picks your kid up, and takes them to the school. Literally, one student per bus. That's how that's working there right now. That one student per bus. There's 9 buses that come in there every morning. I've been counting.
Okay.
And only one student comes off of each one of the buses. So is that the best way to spend the resources? Now, I do understand that she had said that they service 21 counties. So that makes a little more sense as to why one student per bus. If you're driving down to Farmington, you can't come back and stop and pick up other kids and be in a timely manner. But in the same aspect, that means when your school starts at 8 o'clock, that means that kid's getting picked up at 6:15 in order to make it school on time. That's an hour and 45. That's too much time. And we know how much our kids, after about 2 hours of being in the car, I mean,
that's pushing it.
That's pushing it.
Yes.
I mean, the Florida trip was just that never drive cross country. with a newborn and a 3-year-old
was diagnosed with autism.
Yeah, 3-year-old autistic. Yeah, that was that trip. Now I will say that was the very first trip I got communication out of my son, to where he was he actually made a reference to do something.
Yes.
Is because the ocean definitely scared him. So that was a rather interesting trip. So let's see what else we have in here, because So we've covered the ABA,
Mhm.
we've covered the respite, covered the finances. What is this one over here?
It's just a little outskirt of ABA.
Okay. So we're right at about our 30 minutes. So
Yep.
that's where I like to keep it. Like I said, guys, let's see some comments in this one. I mean, if we're gonna reference back to our first video that we did last week. Almost 300 views organically in a week. I mean, that's excellent for something starting out for the first time, and we really hope that everybody is grasping kind of what we're wanting to do here. I know it seems a little open or unscripted because it's not scripted. We prefer. Well, she prefers to have things organized. I prefer to fly by the seat of my pants. You get a much better result, in my opinion, that way, because then she doesn't have any idea what I'm going to say or how I'm going to come at her with things. And sometimes for me, that's the best way to do that with her. That way she doesn't know and she can't prepare for what I'm going to say. That way you get, real feelings, real emotions, and you really, you can really go based on, what the person is truly thinking, and it's not prepared or thought about. I was trying to fix your glasses.
I'm good.
So, all right, guys. Well, that's it for this week. Next week, same time. Not sure what we're going to cover yet, but we'll cover something.
Everybody have a good day and be safe.